So today I'm going to be talking about 2-point crutch gait and swing to and swing through, and what that means. The primary point of crutches is to bear the weight on the patient's hands instead of their legs. The reason for this varies. It could be that the patient can't bear weight on their legs, or it could be that they have an injured leg that could be temporary, it could be long term. It all depends. When you have a patient that is using crutches, you want to fit each crutch to the patient. So you do this by having them stand straight, and then you fit the crutch so that when they're standing straight, their hand rests at the top of their hip on the handle of the crutch. The elbow is bent at a 30-degree angle, and the armrest of the crutch rests about 5 inches or 3 fingertips beneath the armpit. You want to make sure that the patient does not bear the weight on the armpit, but on the hands, even when they're moving. You also want to make sure that the patient knows to inspect their crutches and to keep an eye on them, to look for cracks and breaks, and especially to monitor the crutch tips on the bottom. If those wear away, they could lose grip, and then the crutches will just slide out from underneath them. The age of your patient will also matter, and as well as their physical capabilities. Younger patients and older patients might not be as balanced as they need to use crutches, and if your patient doesn't have the upper body strength to hold their entire body on the crutches, then they won't be able to use them properly or at all. You can use the 2-point contact method if you can bear weight or if you might not be able to. It works with both. It works by moving the left crutch with the right foot and the right crutch with the left foot. You alternate, kinda. So a bit similar to a normal walking pattern, and you place weight on the limbs, but you just also place weight on the hands. You'll find this used with muscle weakness or leg injuries, but oftentimes muscle weakness. If that's the case, they'll probably be using forearm crutches, in which case you have to fit them so that the bar of the crutches are behind the arm. The handle is at wrist level. The top part of the crutch that clasps around the arm will be about 2 inches below the elbow, and the elbow will be bent at a 30-degree angle as well. And that is with forearm crutches. So sitting up and standing and then going up and down stairs, it's the same as with any other crutches, but I'm going to go over it too. So when you have a patient and they need to sit down and they're using crutches, you want them to back up to the chair, find the chair with the unaffected leg, put the crutches on the affected leg side and hold on to them for balance, and then slowly lower themselves into the chair. As for standing up from the chair, you want the crutches on the affected leg side. They will use the crutches on that side to push themselves up, and they will use the unaffected side's hand to push off the chair. Throughout this process, for both sitting up and standing down, you want to keep the affected leg out, away from the chair, away from anything, and don't bear any weight on it. Walking upstairs, you want them to, when they're going up, you want them to first lead with the unaffected leg, and then follow through with the crutches. The unaffected leg will hold the weight on the stairs, and then the crutches will come up and hold the weight while the unaffected leg moves up to the next step. You repeat this until they're to the top of the stairs. As for getting down, it's just the reverse. The crutches come down first, and then the affected leg and the unaffected leg come through after it. So crutches down, then the affected leg, but no weight's left on it. It's all in the crutches. And then the unaffected leg comes after the affected. Swing refers to what you do with your legs when you're using crutches. There's two kinds of swing, swing to and swing through. They mean pretty much just what they sound like. Swing to is when you're putting the crutches forward, you swing your legs to the crutches, and then the crutches go forward and the legs catch up to the crutches. Swing through is when you move the crutches forward and then you swing your legs up to the crutches and then past them forward. And then the crutches move forward past the legs, and then the legs move forward past the crutches. This gait is often used for injuries to the lower limbs or the spinal column as well. So, when you're walking with those crutches, you want to put your right foot forward and left crutch comes with it. Left foot comes forward, right crutch can come with it. You can bear a little weight on your legs, but not all of it. When you're using the crutches, you want to bear all your weight down on your hands, not your shoulders, and not your armpits. Okay?
Okay.
Hands should be waist level. Elbows bent at 30 degrees. You want to inspect the crutches regularly, make sure there's nothing broken. On the end there, plastic pieces. Those can get worn down. You want to keep an eye on them. If they get worn down too much, replace them. That way you won't lose grip when they're on the ground and fall. If they are broken or cracked or anything, don't use them. They can't hold up your weight. Okay? Okay. Keep the crutches 6 inches out and 2 inches forward from your feet so you don't trip over them. Okay?
Okay.
And yeah, so where do you bear weight? What's your weight holding you up?
Where do I bear weight? My feet? My legs?
No, you want to bear your weight on your hands when you're using
Oh,
the crutches.
okay. When I'm using the crutches, yes.
Okay.
Yep.
So when you're walking, how do you do it? Right foot goes forward.
Right
left
foot goes forward with left crutch at the same time.
Okay.
And then your left foot goes forward along with your right crutch at the same time.
Okay. Do you use the crutches if they're damaged?
No, you want to inspect the bottom plastic part, and if they're cracked or broke, do not use them because you could fall.
Okay. We'll stand up. All right. Show me how you use them.
Okay. You said 6 inches from your feet, yes?
Yep.
And you bear the weight with your hands, yes?
Yep.
So we're going to do left crutch, right leg.
Okay. Okay.
And we'll go right crutch, left leg. Left crutch, right leg.
All right.
Like so.
Okay. So when you're teaching them, you really want to make sure that they know how to be safe when they're doing this. That's the main focus you really want to get across. How to use these safely and how to best use them for your condition. You want to make sure they know all the possibilities here and they know what needs done and how to keep themselves from re-injuring themselves or injuring themselves in the first place, depending on why they have crutches.